Stefan, we should start with this really grim news. The nursing home behind me, at least 26 confirmed deaths. And as you guys indicated at the top, several other nursing homes across New York City with death totals in the 30s, 40s, and 50s. One more staggering reminder of the power of this virus when it comes to the most vulnerable population. The devastating death toll of coronavirus now includes new numbers from nursing homes. In Brooklyn, Cobble Hill Health Center, 55 deaths. In the Bronx, Kings Harbor Multicare, 45 deaths. In Queens, the Franklin Center for Rehabilitation, 44 deaths. And on Staten Island, Carmel Richmond Healthcare and Rehabilitation, 44 deaths.
Nursing homes are the vulnerable point.
Governor Cuomo said without federally led testing, there's nothing more the state can do to protect this aging population.
It's not an inspection issue. We've taken radical measures vis-a-vis a nursing home. No visitors. I mean, just think about how harsh a policy that is.
Everyone, I want to talk today. Good morning, everyone. I want to talk today a little bit about the Abbott ID Now machine and the data that just came out regarding the Abbott ID Now machine. You know, about a month and a half ago, the city of Stamford and I were looking at laboratories to use for their municipal workers. And we had a talk with a hospital system who was adamant that the Abbott ID Now was a good machine. You know, I had data from when the Abbott ID Now machine was good morning, Linda, was placed in a head-to-head study with the BioFire and the Cepheid. These are the two machines I have in my laboratory. Full disclosure, I also have the Abbott ID Now machines. However, we are not using them. Repeat, we are not using those machines. Let me tell you why. Well, we had glitches with them when they were the initial Alere machines. We did a software update on them that didn't work. And then when we finally got them working, they wouldn't load, and Abbott refused to give us the kits. They said at an executive level that they would put the kits only up for hospital systems. So the hospital systems jumped all over these machines. What's going on, Dr. Ed? How are you? I'm going to introduce you to one of my main men, right? Dr. Ahmed. All right. So we're here talking about the Abbott ID Now machine, Ed. Talking about the Abbott ID Now machine. And the big problem is that this machine, I saw with influenza that it missed a significant bunch of cases. And in fact, there was a head-to-head study done where the false negative rate was maybe as high as 10%. So when you're looking for a novel coronavirus, a false negative rate of 10% is simply unacceptable. So we didn't even push further with the Abbott machines because they were a waste. And I tried to warn everyone about the waste that they were. Unfortunately, what happened next was that CVS decided to make a deal with Abbott Now and set up all their drive-thrus using this machine, which now, according to a recent study published by NYU, who used the machine in the field, they have unequivocally announced that the CVS machine, the machine that CVS is using at all their drive-thrus, is unfit for clinical use. That's a massive statement. That means CVS right now should stop what they're doing, revisit the machine, and refactor what they can do. Until we know the study was peer-reviewed, I would say CVS is engaging in a big, risky model if they're going to use this machine without stopping and investigating all the data. I knew something was up with this when I asked the FDA and Abbott for their EUA data. Crickets. No one gave it to me. All right? Just because it's a fast test doesn't make it the best test. Okay? Currently, I got to get going. Dr. Ed and I are going to walk through our PPS survey that we're doing today. I got to walk through the 2 PPS surveys that we're doing today in nursing homes. It's Dr. Murphy with Murphy Medical Associates and coronatestct.com. We will be able to help you. If you're a nursing home and you need a PPS, we'll see you. Okay? All right. We're going to walk through today. I'll talk to you soon. Bye. Oh, yeah. Love you guys. Bye. Good evening. Good evening. It's almost 10 o'clock at night, and I'm here at the second nursing home where we did our point prevalence survey. Our point prevalence survey for the Department of Public Health and for the state of Connecticut. This is our second survey today. Many people don't appreciate it, but when you drive through a drive-through and you test people in a drive-through that want to be tested, it's very easy to do. What's not easy is testing patients who don't want to be tested and convincing them of why they need to be tested. Now you add on top of that many of our residents in nursing homes have dementia, and then you recognize that we've been going today from 6 in the morning until 10 at night. Okay? 6 in the morning until 10 at night. So we are working our tail off. I'm just finishing up at the site. I'm waiting for everyone else to come on board. I'm waiting for everyone else to come on board. And when they do, we will go ahead and collect the samples and send them off to the lab, right? So we will be finishing up here tonight in a little bit. So I want to talk about the news again, like I did this morning. The Abbott machine that's done by CVS and their drive-thrus, it's not a good machine, all right? So I would tell people not to get the Abbott test. I would tell people not to get the Abbott test. It's just not an accurate test. And at NYU, they proved that it was not suitable for clinical use. Not suitable for clinical use. So we won't use it, and we haven't used it. We use the other testing machines for novel coronavirus. That's test, treat. I want to talk about how we've been doing telemedicine for patients. And I think we've been able to keep people out of the hospital by getting what we call corona care labs, right? These are coronavirus panels on patients that tested positive or believe that they had the virus or have the virus to make sure that they don't have any damage. Now, most people don't understand what this panel is about, and that's because they don't know about the virus. They haven't read the fact that it can affect a lot of your organs. So we check a lot of stuff that most other people don't. And that's just good medicine. And we've always been doing that. So that's treat. I want to talk about isolate. Being here in these nursing homes has given me a whole new appreciation of how difficult it is to isolate if you have dementia or you're in a nursing home in a multi-bed unit. It is very difficult to isolate those patients. Thanks, Linda. It's very difficult to isolate those patients. I don't envy the nursing homes at all. They were given a gargantuan task that, frankly, I don't think anyone could have effectively achieved what needed to be achieved here. So when we go back to finger pointing and those sorts of things, I think we need to recognize the limitations of residents who are demented, right, who have dementia, residents who are in multi-bed units. It was a tough task. So that's isolation. I want to talk next about tracing. We do contact tracing. So our team is ready to go. We're in negotiations with Salesforce and with Microsoft. Contact, which is the Connecticut version, we've really been trying to get a hold of Dr. Soto here to be able to see if our system can plug in to the state. We're doing PPS surveys. We can probably help them with contact tracing as well. I also know that we're negotiating with Salesforce, which is handling New York City's tracing. And frankly, Salesforce is just a great software. So we'll see kind of where we go, but we're waiting on Dr. Soto. So we've texted you, we've called you, answer the call. We'd like to work with you. All right, this is Dr. Murphy of Murphy Medical Associates. Just finishing up our point prevalence survey here at the last nursing home. It's 10 o'clock at night. We started at 6 in the morning. We're going to try and get some rest. All right, we'll see you again tomorrow. Love you guys. Have a great night. Good morning. Good morning, everyone. How are you? You bet I need the coffee. I went to bed around 1 o'clock in the morning and got up around 5:45. So we had to finish processing some labs. I had to work on making sure the sites were up and running. And today you'll notice I'm not in scrubs. I've been wearing so many scrubs that I ran out of scrubs. So they're all getting washed now. I want to thank everyone for the journey. It is now in week 12, right? Month 3 here at Murphy Medical Associates with our drive-thrus that started on March 10th, which then proceeded to our Corona Care test centers, which came online last month. And now it's proceeded into nursing home testing and what we call a point prevalence survey. We completed 2 of those yesterday at 2 nursing homes that absolutely needed the help. In addition, we continue to care for employees in nursing homes and just perform testing for a nursing home in White Plains, just their employees. The governor in the state of New York has asked that their employees get tested twice a week. But really what I wanted to go over today that I'm really concerned about is the public. This lockdown has driven them crazy. In addition, there is a massive amount of fear out there. Today we had some protesters outside of our Greenwich office, and unfortunately some of them were taking pictures in an area posted that they can't take pictures. You know, in order to protect the public and make sure that we don't spread coronavirus, we do care outdoors. We discreetly cover it with tents or Corona Care pods. Yet, unfortunately, in Greenwich, we had some citizens that wanted to come to our location and take pictures. Now, in a lot of our locations, we've had police presence to help us with this sort of thing. In Greenwich, we have not. It would definitely help us to be able to take care of the public in Greenwich that way. Unfortunately, there's a lot of craziness on the internet. There's a lot of crazy videos on the internet. There's a lot of conspiracy theory out there. And so let me tell you this. We are doctors at Murphy Medical Associates. We do medicine. I'm board certified and licensed in multiple states and malpracticed in multiple states. I am a professor, right? I'm a professor at a medical school. I teach medical students. We have medical student volunteers. I have doctors from all over the world, including international foreign medical graduates, working with me. We know what we are doing. We sharpen and hone our craft every day. We're not crazies. We're not doing anything illegal. We are taking care of patients when many others cannot. We found a solution to be able to care for patients in the public in a safe space, protecting our buildings and the occupants of our buildings, so that way we won't pass coronavirus onto unwitting patients or unwitting customers or unwitting residents. We've been doing this for 3 months. And frankly, I've been doing this for over a decade. So I'm going to ask everyone out there who wants to lodge a protest, who wants to complain about the fact that we're caring for patients in a safe way,
I want you to call your departments of public health. Don't show up at our offices with cameras. It's rude to the patients who are being taken care of. It's a violation of their privacy. If you want to protest and put your signs out in the public, you're welcome to do that. But do not bring a camera on our property. You are not authorized to take pictures of our patients. You're not authorized to take pictures of us. Do not do this. Go to your town if you have a complaint, but do not violate the privacy of our physicians, our nurses, our healthcare providers, or patients. Don't do it. If we need to, we'll have to hire security and escort you from premises. We've been trying to be very nice with the public because we understand their concerns. We talk to the patients every day. We know their fears. We're not here to hurt. We're here to help you. We're here to help us because we're all in this together. I'm going to ask again. Do not bring cameras, video cameras, recording devices onto our property. You are not authorized to record videos. You're not authorized to record content. Connecticut is a two-party state. That means both parties have to agree to being videotaped or recorded. We do not consent to your videos. Please, we're all in this together. Do not violate the privacy of our patients. Do not violate the privacy of our practitioners. I hate to have to put this Periscope up, but I am deadly serious. We have to take care of each other. Please help us do it. This is Dr. Murphy of Murphy Medical Associates and coronatestct.com and coronacarect.com. We are here to take care of you, the citizens of the state of Connecticut and the citizens of the state of New York. We're here for you. We've got drive-thrus. We have Corona Care Centers. We're licensed in the states. We've malpracticed in the states. And we're board certified and we know what we're doing. We're here for you. Okay? This is Dr. Murphy signing off with my public service announcement. Thank you. Good morning, everybody. Today is Saturday, the 16th of May. See the lighthouse? The lighthouse on my cap. That's right. The lighthouse is the early warning sign. And in ancient heraldic times, it meant that we were the early warning. So that way you didn't crash up against the shore, right? You had a lighthouse. So that sailors knew not to crash, not to sail close to the lighthouse, or they would wreck their ships, right? Early warning sign. And it's on our crest, right? It's on our crest of Murphy Medical Associates. This is Dr. Murphy here with Murphy Medical Associates. I want to thank you, Linda, for tuning in. All right. Thank you. Thank you, Jenna. All right. So I want to let you guys know that the results are pouring in for our point prevalence survey of the nursing homes, right? Of the nursing homes that we did, right? Our point prevalence survey of the nursing homes that we did. Here's what I can tell you we found. I feel sorry for the nursing homes. Traditionally, nursing homes have not had the staff that they need. They kind of have turnover. You know, even when you look at the publicly owned nursing homes, like the one in Greenwich called Nathaniel Witherell, they tended to keep their staff. And the reason they kept their staff is because they were funded by the town. So the employees had pensions and a lot of benefits that traditionally are not afforded in nursing homes. Why? Nursing homes traditionally have not been a high margin, highly profitable industry. So therefore, they're constantly working with the sickest of us with one hand tied behind their back. So I feel pretty bad for the nursing homes. So we're working with a bunch of the nursing homes there to source affordable coronavirus testing. Because in the state of Connecticut, insurers are mandated to pay. Okay? And we do not charge. And so we bill insurance. So that's our goal, right? Test, treat, isolate, and trace. In the nursing homes too. I think we should be testing employees and residents in the nursing homes. The employees that I saw were working so hard. Did any of them have N95s? No. None of them had N95s. Did any of them have Tyvek suits? In one of the nursing homes, they did. I was very proud of that nursing home. The people that had real direct contact were in Tyvek suits. They also had isolation gowns. In the other facility, not as much. Again, nursing homes are operating with one hand tied behind their back under situation, in my mind, which is far more difficult than the hospitals. Far more difficult than the hospitals. They have demented patients that they cannot keep in their rooms. They have demented patients that they have a hard time keeping them on their wing. It's a real issue. So, we have a lot of positives in the nursing homes. A lot of positives. And my hope is that we can maybe consider doing the following. If you're not positive, quarantining these patients, right? Quarantining these patients that are not positive, trying to cohort them together and take the positives and place them together and try and separate your facility. The problem is the sanitization that is required in a building. The ventilation that is required in a building is inadequate in most facilities right now. It's inadequate. All the windows should be open. They should be airing and blowing the places out, except for the fact that demented patients can escape that way. So you can't do that, but you have to open them up enough to get wind and blowing and negative pressure. A radical redesign needs to happen for nursing homes in order to be able to care for these patients properly. All right, so I'm going to put my mind to that this weekend. I'm going to think through that. All right, nursing homes, I feel sorry for you. We're here for you at Murphy Medical Associates. We'll let you know who your positives are. We'll work with the state. We'll work with the local DPHs. We'll bring our people in to test, to treat, to isolate, and to trace. We're here for you. Okay? I already got a couple of nursing home directors texting me right now. I'm going to have to reach out to them. So I'm going to let you guys go today, Saturday, the 16th of May. All right? I don't want to be all doom and gloom, but I'm here to tell you right now, nursing homes have a gargantuan climb ahead of them. Gargantuan climb. We're here for them at Murphy Medical Associates and coronatestct.com. That's coronatestct.com. Have a good Saturday. I love you guys. I'll talk to you soon. Take care. Good evening, everyone. How are you doing? I am recording here. Tonight is Sunday, May 16th. Sunday, May 16th. I'm here with a couple of my kids. Hey, Chris, what's going on? How's phlebotomy school? Hopefully everything's good. We look forward to have you back soon. So I'm recording this Sunday kind of to give an update. And, I had a patient yesterday ask me a ton of questions and say, what would Dr. Murphy do, right? What would Murphy do? And so I thought it was really interesting. Hey, Linda, how are you doing? I thought it was really interesting to think about. Oh, nice. Exam Thursday. Go get it. Good luck, Chris. Do your best, right? You know what we say at Murphy Medical Associates. Do your best and be good to each other. That's all you can ask for, right? You study and you work hard and do your best. That's all you can do. You'll always be part of the family. No worries. So, yeah, I know, me either, Chris. We definitely need you back. We're exploding. We are going to start blood draws in New Haven on Thursday. So we're going to be doing antibody testing in New Haven. We're going to be looking at liver and kidney function. We're going to be looking at endocrine issues because we know that the novel coronavirus really affects all sorts of organs. It's not just, oh, do I have antibodies or not? No. Is your heart okay? We check blood work for that. Is your endocrine function okay? We check blood work for that. Is your lung function okay? We check some blood work for that. Is your kidney function okay? We check some blood work for that. Is your neurologic function okay? Well, we check some blood work for that too. We don't mess around, right? We want to make sure that if you've had the novel coronavirus, or you think you've had the novel coronavirus, and that it will cause immune system issues, then we've got to take care of it. Right? We're going to do the right thing. We're not going to do the little thing. We're going to do the right thing. We're going to go all the way because we are doctors. That's what we do, right? Murphy Medical Associates. We're not just a lab and going to test you. We're not just a pharmacy and going to, I don't know. I mean, don't get me started, right? I'm not going to talk about any of those at all, right? So the moral of the story is simple. Do your best and be good to each other and treat your patients like family. And that's what we'll do. So what would Murphy do? Well, Dr. Murphy would treat patients like family, right? And that's it. And that's it. Just do what Dr. Murphy would do. Things are going to work out just fine. So a couple of questions I got. One of them was, are you going to vaccinate your kids with the novel coronavirus vaccine? Whoa, right? So first off, there isn't even a vaccine yet. Number one, there isn't even a vaccine. Number two, whatever has been there hasn't really been studied. So it's really tough to say, right? Number three, they have an old adage in medicine, right? Never be the first or the last to try a new medicine. Why? Because in the first 6 to 12 months, what we call the run-in period, that's where the rubber meets the road. Any of the research that was done may have missed a subset of people who are going to have a bad reaction. So those people get shaken out in the first 12 months. It's kind of like in the stock market, right? Where people buy an IPO. The price goes up and then it gets sold, right? So all the people that had invested in the company before the IPO sell at the top. And when that happens, boom, the price goes down. So if you bought it at an IPO, you often buy it at a much higher price than if you would have waited 12 months. So in terms of vaccine, unless this thing is studied golden, I am not going to vaccinate until we've had a year's worth of study. We know how to prevent infection, right? We prevent infection with good hygiene. Sorry about that. I switched it up. It was just getting too noisy out there. So the question is, Dr. Murphy, would you vaccinate your children? I do vaccinate my children with vaccines that have been studied for quite some time. Will I vaccinate my kids, right, all of my children, for the novel coronavirus vaccine? Don't be the first or the last to try a medicine. The same is true of vaccination. And so I will watch for the data. I'll read it scientifically. And when Dr. Murphy says, I'm going to vaccinate my kids, then you know that I have high confidence that the vaccine makes sense. This is kind of one of the questions that people asked. Another one people asked, what would Murphy do, is when can I see my grandchildren again, right? We know in the data that maybe most children don't get affected very badly. There can be asymptomatic carriers, but they definitely spread the virus. And a subset of kids do very poorly. And we now know of this pediatric inflammatory syndrome called PIMS, which is similar but not the same as Kawasaki's, not the same as toxic shock syndrome. And so kids get infected, right? We'll go straight back through the vaccination process, right? So when can the grandparents see the kids again? Well, I think there needs to be some social distancing, number one. Number two, I think another thing that matters that's very important is that you have to look at time in quarantine. If the grandparents have been quarantining successfully, social distancing successfully. Hi, Linda. Sorry about that. I had to switch up. And if the children have been quarantining and social distancing, right before Connecticut opens up, right before it really opens up, right, which is May 20th or whatever, is probably the safest time you could have contact, socially distanced away from each other, right? Socially distanced. It's probably the safest time. I think that, I believe that as we open up, there will be more transmission. There's just going to be more risk. One of the things we're seeing is Sweden's experiment has led to increased death, front-loaded death, right? Rather than over the course of everything death. It's a front-loaded death. Now the question is, will that continue? Will the set of death continue? Will the older population have a higher mortality? We know in a lot of the studies that are coming out now, they had excess mortality relative to everyone else. That's because they didn't shut down their economy. They didn't shut down their economy to protect their most vulnerable people. And that's what they decided. And, there are lots of countries like that. They're very utilitarian, where they focus on exercise is great. Linda, I saw you the other day. You put that out there. Exercise is key every day. 30 minutes. Go for a walk. Get on the elliptical. Get on the treadmill. Lift weights. Get some sun. Take vitamin D. Probably better for you than vitamin C or zinc or any of that other jazz, right? If you're low, 5,000 international units. That's what Murphy would do, right? What would Murphy do? That's what I would do. That's what I'm taking. I'm actually taking 10,000 every other day rather than 5,000 every day. 10,000 every other day. It doesn't really matter, I'm just not taking the big ones, the 50,000. That's great you do more than 30 minutes. It's good. It's good. So just not the 50,000, the big ones, because they can cause kidney stones. So Dr. Murphy would not do that, right? So it doesn't make any sense. So those are the two what would Murphy do questions of the day. So I have an answer. I'm going to continue to do that every day. If you guys send me a direct message or whatever, you can say, what would Murphy do? And I'll give you advice. I'll kind of give you advice of what I would do. 5 miles of walking is fantastic, Linda. Fantastic. It's a great walk. So onward to the week. I talked the other day about the nursing home issue and the shortage of PPE they have, the difficulty with testing and treating there, the difficulty with isolating. There are some real operational challenges. Speaking about the most vulnerable of us, those in nursing homes are some of the most vulnerable among us, and so we have to protect them. In addition, the workers that work in nursing homes are some of the most vulnerable among us, and so we have to take care of them as well. So as I said before, I posited the following: take a wing of your nursing home, turn it into a hospital, so that way you can take care of the sick ones and keep them in there, in your units, right? Bring a hospitalist on board so that way you can afford to pay to have a physician on staff of your nursing home at all times. This is not to besmirch nurse practitioners. They do a fantastic job, but sometimes you need a physician, especially if people are acutely ill, right? Otherwise, you put sick people in and out of the hospital all the time, and then the ER doctors are exposed even more than they need to be. I think my strategy will work, and I think it'll help the nursing homes too, right? I really do. Let's talk about those most vulnerable among us, those who are hungry, those who need to go get food at a food bank because they can't make ends meet, or because they lost their jobs, or for whatever host of reasons that they are going and getting food. Really excited. We're working on a project with the city of New Haven. I'm hopeful Stamford will follow suit, and I'm hopeful Bridgeport will follow suit, where we are looking to set up our walk-through testing centers paired together with food banks, paired together where people need to be tested, where they need to be identified and taken care of. Obviously, we're not going to get them in line at the food bank, but if we can test them and they're sick, we can keep them away from spreading the virus in the line for the food bank, right? And we can have someone go get in line for them and take care of them. And so we're very dedicated to this. Further information to follow, but in the end, we'll probably have 5 sites in New Haven. I believe that we'll probably have 3 or 4. Yeah, right, exactly like the Chrysler Center in Hartford, right? I agree with you. So I think that we're going to have probably 5 sites in New Haven. I think in Stamford, it's been hit or miss. We got it early. We had a huge population. We've relocated away from the beach in Stamford. We're now by Stamford High School, in that back parking lot there, where people were tailgating. So that's where we are. People that wanted to go to the beach. So I'm not going to fight with them. And it doesn't make sense. But they need to be outside and they need to be safe. Outside and safe. That's the key. Socially distanced. That's a good thing to do. I want to talk about being outside and parties outside and these sorts of things. You don't have nearly as much transmission outside. This is why I said buildings will never be the same. Buildings will never be the same. I think we have to shoot for buildings with very high ceilings and very good ventilation, with HEPA filters in the ventilation. HEPA filters in the ventilation, and maybe in the locations too. But I don't think you can have these small packed buildings anymore. I think New York City will be forever changed with the tight packed buildings, tight packed subways. It's just not going to be the same. Not going to be the same. And so medical offices, I think, need a radical redesign too. I think a medical office needs to have very high ceilings. I think it needs to either have negative pressure rooms or the windows have to open. You have to be able to vent the medical practice and maybe even set up fans blowing out the windows to create your own negative pressure room. I think those are things that should happen in medical practices. And so we're working on doing that in our medical practices. The tough part always is the property managers, right? Because they think they know more than everyone else when they really don't, especially when it comes to hygiene and health, right? They should turn to their doctors in their buildings and listen to them because they're there to work together with them in property that they need to occupy, right? It's just that simple, right? It's not just about how much rent rolls you collected. It's not about the rent roll. It's about doing the right thing. And so I really want to encourage property managers to listen to the private practice doctors that are in their building. Listen to the non-private practice doctors that are in their building. It's important. They're there to help you, right? It should not be a pejorative relationship. Okay. So the most vulnerable among us need to be taken care of. Number 1. Number 2. No, Linda, I try not to use the word stupid, right? That's a bad word, right? That's a bad word. In fact, one of my kids, it's awesome, will shout at you if you use that word, stupid. Bad word. It's not a good word, right? So I can say they're ignorant, which means they don't know. They're not aware of the situation. Health literacy in the United States is at an all-time low. So I can't blame them, right? As a geneticist, one of the first things I ask if I'm going to talk about genetics is, what do you know about genes? And people don't think, right? That's human beings, right? This is the tragedy of the commons, right? You can read about it, the tragedy of the commons. Everyone's really only thinking about their own self and the utilization of a common resource. And each one will exhaust that resource as quick as possible, leaving the rest of them without it, because it's an inherent not thinking globally about that. The problem is the other side. If you think too globally, you end up like Sweden, and you end up with an excess mortality rate, right? A front-loaded mortality rate. The hope is that you can't get coronavirus again, but boy, if they're wrong, well then put on the helmet, right, Elsa? Right? You put on the helmet. They're in for a bumpy ride. They're going to be in for a frozen bumpy ride in Sweden. Yeah, like the helmet, right? They're in for a bumpy ride, right? The total bumpy ride if you can get the virus again, because then they go, whoa, wait a second. Oops. I thought we'd get herd immunity. Isn't that what they said we'd get? So, lives are money. Lives are money. And it's very tough when you're not the world's reserve currency. So, here's my take as I've rambled and meandered throughout the rest of this 2-part podcast, right? I'm going to start podcasts with questions from patients or anyone else. It's kind of like the what would Murphy do segment, right? And then I'll give a little commentary of where I think I see the future going and what needs to be done. In this case, I talked about buildings today and how commercial real estate needs to have higher ceilings and better ventilation. I also talked about medical practices and how they need to have windows and ventilation, and the building should work on trying to create a negative pressure room. Maybe multiple doctors in a building can try and go in together on a room that they can construct. It's a negative pressure room. Personally, I think until we really get a better handle on this virus, I think a lot of care actually should be like restaurants. It should be done outside. And I have a strategy for that, including little pod offices that can go outside. And so I'll talk about that another time. We are going to be offering walkthrough testing at food banks. And so we're working on that as well. Not the same as CVS that is doing testing in their drive-thrus of their pharmacies, right? We're not going to do that. Similar to how the governor of New York has enlisted the churches to help those in most need, where he will open testing centers in the churches, which I think is a brilliant model, right? We'll do food banks, you do churches. I think that's a great way to split the difference, especially to help those in need, which is the most important thing. Not help those that are going to buy your candy bars, right? Not help those that are going to buy CVS doesn't sell cigarettes anymore. Instead, they just sell sugar and processed food, unfortunately, right? Which, if you read the studies, is probably just as dangerous as cigarettes, especially with the coronavirus, where obesity really led to poor outcomes, where uncontrolled diabetes really led to poor outcomes. So we've got to fix those things as well. I'm not going to wax any more poetic other than to say I thank all of you for tuning in, right? What would Murphy do? He would thank all of you for tuning in. You're part of the family, right? Welcome to the family, right? Have a great week. Have a great week. We've got corporate sites going up with a governmental contractor on Thursday. We've got a corporate site going up with one of the largest grocers in New York and definitely largest grocer in Westchester County, New York, going up on Friday. We're going to have additional sites in New Haven starting probably Wednesday, I think is the day. We're going to be drawing blood in New Haven at Chapel and Day on Thursday. So we got a lot of stuff going on. And I got a meeting with the Bridgeport team, and we'll work with DPH on their PPS surveys. Thanks. It's going to be a long week. I hope you guys get some rest this week. I'm going to try and at least get a little sleep soon. I hope you guys exercise, right? I hope you guys enjoy the sun and maybe take a little vitamin D, right? While we at Murphy Medical Associates will test, treat, isolate, and trace. Test, treat, isolate, and trace, right? At coronatestct.com. It's coronatestct.com. It is Dr. Murphy. Thank you very much for tuning in. I'm going to let all of you go. Have a great, great week. Good evening, everybody. It is the 18th of May, and I've got a new iPhone. That's right, my iPhone kind of gave out because I had put too much hand sanitizer on it. Hey, Linda, how are you doing? Used a little too much alcohol, a little too many wipes, and too much hand sanitizer. So I got a new iPhone. Hopefully it doesn't show all my wrinkles. So I wanted to touch base with everyone. I wanted to let them know that we are moving down into the boroughs of New York City. I'm glad you're doing well, Linda. How's the walking coming? You're doing a bunch of exercise, I know. Hopefully you're keeping up with it. Make sure you hydrate, stay hydrated, right? And consider muscle building exercise, like lifting weights. It is very, very, very helpful. Uh-oh. I'm going to let you go because one of my docs is calling me. I'll be back. And I'm back. It is Dr. Murphy with Murphy Medical Associates and coronatestct.com. It's coronatestct.com. Next up in the What Would Murphy Do segment, right? Because I think I said last time that one of the things I'm going to do is people ask, well, what would you do? What would you do in that situation if it was your family or if it was your kid or whatever? And so tonight I want to address a what would Murphy do, right? As you already know all the things we're doing in our drive-thrus in Westchester. Hey, Linda, see, I told you I'd be back. In Westchester, Fairfield, and New Haven counties, soon to be in Hartford County. We'll see, Linda. All right, so we're working on those things. Soon to be in Putnam County, New York, too. So we're working on a big county expansion, both counties, Putnam and Hartford. So we're working there. All right, so what would Murphy do? Well, let's talk about one of the things someone asked me about the other day, which is takeout, right? Which is take out food. That means that you trust someone, some restaurant, or some food preparer to prepare food for you, right? This has been a hit or miss enterprise, right? And I have had takeout food. I have. At first, I tried for a really long time not to have takeout food. Why? Because we found the virus in the stool, right? We found it in sewage, which made me wonder if we could do what is called fecal-oral transmission. That means if you don't have good hand hygiene, you put your hands in your mouth, right? You theoretically can inoculate yourself with the virus from a fecal-oral, right? Fecal means stool or poop, right? For lack of a better word. So could we get coronavirus this way? And it isn't usually how we get coronavirus, right? I mean, you're catching a common cold with a fecal-oral route. But I didn't know. We still don't know. But what has been studied so far seems to indicate that it is not the main mode of transmission in the body, fecal-oral. So I have gotten takeout, but here's the catch. I microwave it. Yes, I microwave food, and I know, and GMO and all of that. I'm going to hear a lot of it, right? I get it, right? I don't eat takeout food often, maybe once a week. Maybe once a week I get takeout food. Right? I would get takeout food and I microwave it. It's destroyed the food that I've wanted to eat, right? Like a nice steak that I could grill on my own, or Mexican food, right? You want to talk about destroying Mexican food? Microwave it. But you get some of the taste. The microwave kills the viral particles. It kills them. So that's the only way I'm doing takeout. So what would Murphy do? Well, Murphy, if he did get takeout, which he'd only get once a week, Dr. Murphy would microwave it, right? Microwave it to kill particles, right? To try and disrupt what is there as a viral particle. Could you do ultraviolet light? Yeah, but you'd have to wait at least an hour. One of the things way back in the day in TB, they actually had ultraviolet lights in the room, right? But they didn't flash on you because you could damage your eyes with ultraviolet light for a long amount of time. We're not talking the type of ultraviolet light that is in like college dorm rooms, right? The hippie rooms and that sort of stuff. No, we're talking very strong ultraviolet light. It would actually bounce up on the ceiling, right? Because they used to do this for tuberculosis, and the particles were aerosolized, right? And so the ultraviolet light would kill the mycobacterium, the bacteria. And so that's what they did. So I have an ultraviolet light case for my phone. I put my phone in it before I shower, right? So another, what would Murphy do? Well, if I'm exposed to the virus with my clothes on, and I am every day, I get out of the car, I take my clothes off, I hit the shower, but I put my phone in an ultraviolet case. Just because. It's not going to hurt. So that's the thing. What would Murphy do? And take out food. Well, as I said, I'm working with the Westchester Restaurant Association to help develop guidelines. And I know that the state of Connecticut is working really diligently on that open that's coming on Wednesday. And of note, as I said before, capitulating for political reasons is probably not the smartest thing to do. So there was a real need for blow drying hair, a real need in public for blow drying hair for those who are going to get their hair done. It's an essential part of a lot of styling for people, for citizens. And so it was not a smart thing. And I didn't necessarily call out my governor, right? Because I happen to think that Governor Lamont is doing a good job. He's working very hard. And I know he's got a lot of input from a lot of people. I totally understand that. But I told him it was an experiment that I wouldn't want to get into. So he's paused the opening of barbershops and hair salons until he can get through the sticky issue of aerosolizing droplets, right? You blow dryer, you go whoosh, right? It's like you're coughing or sneezing. You're blowing respiratory particles. Now, are they in a mask? Yes. Well, will it leak from the mask? It depends on the mask. It depends on the mask, right? Mayor Elliker is making sure and asking that people wear cloth masks. That's because N95 masks are tough to come by. They're tough to come by. They're also very expensive, right? These are masks that used to be 89 cents a mask that are now $4 a mask. I just paid $4 per mask for these masks. That's insane. But I have to because I have to protect my people. So the governor has to protect his people, the citizens like me and Linda, right? And those other citizens that live in Connecticut. So I think it's smart to pause on hair salons and barbershops until we can definitively sort out the blow drying or hair drying efforts. I've got a solution. You ready for the solution? Haircuts in the parking lot. Haircuts in the park. Haircuts outside of your house. Have the stylist go to your home outdoors on your patio. Are we ever going to be able to go without masks? Linda, listen close. Yes, we will. We just don't know a lot about this virus right now. We know that it kills 1% of people. We know that if you're elderly or overweight or have a low vitamin D or have high blood pressure, that it will kill you at a higher rate. So those people have those risks. We have to protect those people. And wearing masks helps us protect those people. That's all. Helps us protect those people. As a board-certified weight loss doctor, if I can help people lose weight, that also is helping protect those people from that risk. Why? Obesity is a pro-inflammatory condition. So to answer your question, will we not have to wear masks in the future? The answer is yes. It's just not yet. We don't have an effective treatment for this virus. We don't know exactly how it spreads. We don't have a parallel system to take care of those who are positive, right? We don't have a parallel system. They have to intersect with those who do not. And we don't understand about immunity fully. Because of that, we wear the masks. Because we say, I don't want you to get the virus if I have it. We also test. Test, treat, isolate, and trace. We test. One of the big things I know that's why we want to test you, right? You got to understand that. I get it. I will tell you this, Linda. CVS is opening testing centers in Hartford County. CVS has tested 20,000 people in New Haven. That's more than all of Yale New Haven Health System has tested. CVS at their drive-thru on Long Wharf. Okay? That's great. Except they used the machine that has an inordinately high false negative rate. So I've actually had people, healthcare workers, test negative at the CVS drive-thru, only to continue with symptoms and show up and test with us. And they were positive. Maybe because they were prodromal before, but they really had symptoms before. So they should have tested positive, but they had a false negative. We know based on the NYU study, we know based on the other studies that false negative rate of those ID Now machines from Abbott can be like 30%. That's a pretty high rate. So, in closing tonight, because everyone needs to get to bed, what would Murphy do? Take out, no more than once a week, microwave it. Number 2, exercise, weightlifting exercise. Let's take a look here, right? Don't have to be a lot of weight, but a little bit of weight, okay? Exercise, weightlifting, okay? Walking, weightlifting, hydrating, vitamin D, 5,000 international units daily, and get you some. All right, it's Dr. Murphy, Murphy Medical Associates, and coronatestct.com, telling you guys to get some rest, exercise, take your vitamin D. All right, love you guys. Have a great night. Talk to you later. Bye.
We wanted to leave you tonight with scenes of hope, starting with this family in Rockford, Illinois, that built a hug guard so that 85-year-old great-grandma Rose can hug her grandkids safely. And in New Jersey, COVID-19 was no match for 108-year-old Sylvia Goldshaw. She lived through the 1918 flu pandemic, and now she's one of the oldest survivors of coronavirus. And this celebration in Illinois, 4-year-old Amelia getting a cheering send-off after battling that mystery syndrome. She's headed home just in time to celebrate her 5th birthday. Happy birthday, Amelia.